Imagine a small white hospital room humming with noise. It is 11:52. You are lying in bed, drifting in and out of sleep, when the room begins to change. The walls sink inward, inducing the panic that they may just swallow you up. Objects within begin to appear microscopic. Meanwhile, your legs appear to have grown immensely, a lapsed footage of an ancient, towering tree. Within minutes, you have slowly re-entered the real world. Your legs aren't as long as trees, just regular legs. The walls have anchored themselves back into place, and the contents within them wouldn't fit inside of a dollhouse anymore. Your trip to this unearthly, funhouse mirror of a place seemed to last for hours, but when you look at the clock, it blinks 12. The concept may seem absurd, but according to NeurologyTimes.com, is a similar occurrence to that among 10% of the population. Many of this 10% may only experience a handful of these episodes throughout their lives and will never identify the cause. Today, I will be informing you all about Alice in Wonderland syndrome, a disorienting neurological condition that affects perception. More specifically, I will address the etiologies, symptoms, and experiences of those with AW syndrome. We will also touch base on the current medical research being done by neurologists and the original discovery and diagnosis of the condition. Alice in Wonderland syndrome is more common than you may believe and should be universally known and understood by future generations. Though it is difficult to generalize the syndrome, considering the broad range of cause and effect AWS encompasses, it is most often characterized by distorted perception. According to PubMed.gov, common symptoms include micropsia, seeing things as abnormally small, macropsia, vice versa of the latter, teleopsia, the condition of feeling as though one's surroundings are actually very far away, and finally, palopsia, the condition of feeling as though one's surroundings are distinctly close. Similar to LSD use, Alice in Wonderland syndrome may cause hallucinations, both auditory and visual, which lead one to feel as though they have entered an alternate universe. Many patients suffer a diminished concept of time, as previously mentioned in my opening narrative. The 8 minutes between 11:52 and 12 may feel like hours during an AWS episode. Now that you know more about Alice in Wonderland syndrome, you may wonder how one acquires it. Some causes for this strange phenomena range from brain tumors to sleep deprivation. In between, temporal lobe seizures, the Epstein-Barr virus, head trauma, infection, migraine, the use of psychoactive drugs like LSD, and even some types of cough syrup. Most often, AWS is hereditary, according to TheAtlantic.com. Families with a history of epilepsy may feature many cases of AWS as well. A study performed by neurologist Owen Pickrell found the link between these conditions, as they both impact the occipital lobe, the section of the brain involved with vision. According to wisegeek.org, the condition onsets in adolescence, usually from ages 2 to 16, before ebbing in the late teenage years. However, medical conditions aforementioned, give few others, may be the cause of Alice in Wonderland syndrome among adults. Aside from the fact that AWS is a psychophysical condition, meaning that it relates physical stimuli and mental phenomena, it may also take negative tolls on an adolescent's mental well-being as a whole. Even many of the adults among a hereditary bloodline of AWS did not want to admit that the condition had affected them, fearing that others would believe they'd gone crazy. So, imagine being the child whose world is seen through the wrong end of the telescope, in the words of Helene Stupinski of the New York Times. Children may not understand that these episodes are a passing tide, and the things they see and hear aren't real. When parents who have not experienced AWS hear about their child's symptoms, a common fear is that the child may be showing signs of a brain tumor or stroke. According to a survey conducted by neurologist Owen Pickrell, so the diagnosis of AWS is really a relief. That being said, there is no cure for the condition. A treatment plan is penciled in. A good nap, migraine prophylaxis, ironically being psychoactive drugs, one of the causes of AWS episodes, and a migraine diet, the avoidance of foods including monosodium glutamate. However, strides are being made, including studies like that of Owen Pickrell and of Grant Liu, whose involvement will be further touched upon in a moment. At the very least, we've obtained some concept as to how to hit the mute button on side effects. When it was first discovered in 1955, English psychiatrist John Todd described a series of strange occurrences among adult patients, coined with the term Alice in Wonderland syndrome. If you've yet to build a bridge between a neurological illness and this beloved classic, allow me to enlighten you. In the late 1800s, famous author Lewis Carroll wrote a book titled Alice's Adventures in Wonderland, which depicted a young girl who fell into a rabbit hole and entered a strange fantasy world. On multiple occasions throughout the novel, Alice consumed substances that caused her to grow far too large for her environment and then shrink down small enough to drown in a puddle of her own tears. AWS patients often feel like Alice in this sense. Something that I found interesting was the discovery of journal entries in which Lewis Carroll describes suffering severe migraines. As previously mentioned, migraines are one of the conditions affiliated with AWS. More so than mere affiliation even, is the fact that 25% of a test group of children with AWS in the years 1993 to 2013 went on to suffer severe migraine, according to a study conducted by neurologist Grant Liu in 2014. Here's where the term migraine aura ties in, defined by MayoClinic.com as a perceptual disturbance experienced by some before either a headache or seizure begins. It often manifests as a perception of a strange light, an unpleasant smell, or confusing thoughts and experiences. Essentially, AWS is a migraine aura on steroids, being that an episode is a predecessor to migraine. This raises the question of whether some elements of Alice in Wonderland may have been inspired by Carroll's own experience with migraine and migraine aura. After having learned about the condition's causes, symptoms, and studies, you've likely formed some questions of your own. Considering the obscurity of current studies and lack of a cure, it is difficult to pinpoint when many of these questions may be answered. As years pass and more patients are given a diagnosis to match the unusual symptoms it comes in hand with, neurologists will work to find answers. In the meantime, remember what we have discussed today, a mere superficial scrape of all this unusual condition entails. The symptoms and causes of AWS, the age group where an onset is most common, and the current efforts being made by neurologists to learn more about Alice in Wonderland syndrome. Please remember what I've taught you today, don't drink any magical potions, and watch out for rabbit holes. Thank you.